Most people have heard of anxiety medicines. You might even know someone who takes them, or maybe you've been prescribed one yourself. But very few understand what really happens when these medicines are stopped. It's not just a little discomfort. Sometimes it can be confusing, overwhelming, and even dangerous. Today, we are going to break down benzodiazepine withdrawal in simple terms so you understand what it is, why it happens, and what to watch for. Before we start, there's one thing you must know. This video is for educational purposes only. It is not personal medical advice. Everyone's situation is different. Never stop or change medications without talking to a doctor or qualified healthcare professional. These medicines are powerful, and withdrawal can be risky if not done carefully. Keep this in mind as we go through the information. So first, what exactly are benzodiazepines? These are medicines designed to calm the brain and nervous system. You may have heard them called sedatives, tranquilizers, or anti-anxiety medicines. The most common ones are Xanax, Ativan, Klonopin, and Valium. Doctors typically prescribe them for anxiety, panic attacks, or sleep problems. They are very effective, fast-acting, and can help people feel relaxed in moments of intense stress or insomnia. The calming effect is almost immediate, which makes them useful in short-term situations. But here's the reality most people don't know. These medicines are not meant for long-term daily use in most cases. Over time, the body adapts, and this is where problems start. When benzodiazepines are used regularly over weeks, months, or years, the brain becomes used to the extra calming effect. This is called tolerance. Simply put, the same dose that worked before may no longer feel as strong. People often feel they need more to get the same effect, which increases the risk of dependence. Dependence means the brain relies on the medicine to maintain balance. Without it, the nervous system can go out of control. And this is when withdrawal can happen if the medication is stopped or reduced too quickly. Now, why does withdrawal occur? It's all about balance inside the brain. The brain has two main chemical systems. One slows things down. It keeps you calm and relaxed. The main chemical involved is called GABA. The other system excites the brain and body. It's responsible for alertness, movement, and the go-go-go signals. The key excitatory chemical here is called glutamate. Normally, these two systems work in harmony. But when benzodiazepines are used daily, the brain adjusts. It reduces its own production of calming GABA chemicals because the medicine is supplying extra. Over time, your nervous system becomes dependent on the medicine to maintain that calm state. Here's where it gets tricky. If someone stops their benzodiazepine suddenly, the brain now has less calming GABA, but the excitatory glutamate is still strong. This imbalance causes the nervous system to go into overdrive. People can feel anxious, restless, or panicky. Their heart may race, muscles may tense, sleep can be impossible. In severe cases, this overactivity can trigger dangerous symptoms like seizures or confusion. This is why doctors never recommend stopping these medicines cold turkey unless under strict supervision. Withdrawal symptoms can range from mild to severe, and they don't all appear the same for everyone. Mild withdrawal might last a few days. People can experience rebound anxiety, meaning their anxiety becomes even stronger than before taking the medication. Sleep disturbances are common, with insomnia lasting for days. You may feel on edge, irritable, or just off. These mild symptoms are uncomfortable, but generally manageable if handled carefully. Moderate withdrawal is more intense and can last weeks. People may sweat excessively, shake, feel nauseous, or have headaches. Muscle tension, aches, and poor concentration are common. Digestive issues like diarrhea or vomiting can occur. Fatigue and irritability are constant. The body feels physically unwell, almost as if fighting off an illness. For many, these symptoms are frustrating enough to make them go back to the medication, creating a cycle that makes tapering more difficult. Severe withdrawal is rare but dangerous. This can include seizures, which may happen even if the person has no prior history of epilepsy. Multiple seizures can occur in a row, creating a real risk of death. Severe withdrawal can also cause psychosis, where a person experiences hallucinations or paranoia temporarily. Another extreme symptom is delirium, a state where a person becomes disoriented, confused, and unable to recognize their surroundings. These severe symptoms require immediate medical supervision. They are why benzodiazepines are classified as controlled substances, and why stopping them requires a careful, supervised taper. Not everyone will experience severe withdrawal. Some people tolerate reductions fairly well. But the problem is, no one can predict exactly how a person will react. Risk depends on several factors: how long the person has been taking the medication, the dose, whether the benzodiazepine is short-acting or long-acting, and even genetic factors. How quickly the drug is stopped also matters. Because of all these variables, doctors often design a slow taper, reducing the dose gradually over weeks or months to minimize symptoms. Even mild withdrawal can feel shocking. Imagine your body and brain, accustomed to a sedating signal, suddenly having none. Anxiety spikes. Sleep disappears. Concentration fails. Fatigue takes over. It can feel overwhelming. For those with moderate or severe withdrawal, the shock is even greater. People report feeling like they are losing control of their body and mind. This is why awareness is crucial. Knowing what to expect and preparing for it under medical guidance can prevent unnecessary suffering and danger. So how can withdrawal be managed safely? The most important step is planning with a healthcare provider. A gradual taper is the gold standard. Doctors may switch patients from short-acting benzodiazepines to longer-acting ones to make tapering smoother. Doses are reduced slowly over time, allowing the nervous system to adjust naturally. Supportive care, like counseling, relaxation techniques, and sometimes additional medications, can help manage anxiety or insomnia during the process. Education is also key. Understanding why withdrawal happens can reduce fear. Many people assume withdrawal is just psychological, or that it means they are weak. In reality, it's physical dependence and chemical imbalance in the brain. Recognizing this makes the process feel more manageable and empowers patients to work with their providers. It's also important to address long-term anxiety or sleep problems with alternatives. Benzodiazepines are effective for short-term relief, but for chronic issues, strategies like cognitive behavioral therapy, lifestyle changes, and non-benzodiazepine medications are safer and more sustainable. The takeaway is simple. Benzodiazepines can be life-changing medicines when used responsibly, but stopping them suddenly can be dangerous. Mild withdrawal is uncomfortable. Moderate withdrawal is tough. Severe withdrawal can be life-threatening. Knowledge, preparation, and professional supervision are your best defenses. If you or someone you know takes benzodiazepines, never stop abruptly. Talk to a doctor about tapering strategies. Watch for early signs of withdrawal. Anxiety, insomnia, shaking, sweating, or digestive issues can all be warning signs. Acting early can prevent severe complications. Remember, this video is educational only. It does not replace medical advice. Always consult a qualified healthcare provider before making changes to medication. Being informed about benzodiazepine withdrawal can save lives. Awareness matters. Understanding the risks, symptoms, and safe tapering strategies can empower you to take control of your health without unnecessary danger.